Okay, it is 1:01 and today is Monday, May 17th. Welcome to our Health and Human Services Committee meeting. I would like to call the meeting to order. Legislator Grandison has asked to be excused today. And I see Amanda and Mike Sigler. And good evening, Leslie. Nice to have you. So we do have enough for a quorum here. Wanted to ask, are there any changes to our agenda from committee members? I am actually going to have one change, and that is going to be to ask Kit to give us an update on the ERAP funding. I know that Deborah and Martha both wanted to hear the update, and I think Deborah has to leave early for another meeting. So if we could go to public comment, and then we'll do the update, if that's all right with everyone. Okay. Let's go ahead and open it up to public comments. I would also like to make note that we have received 4 email responses. All of them were in favor of supporting the resolution for the New York Health Act, and legislators should have received those. Let's start public comment with Judith Jones.
I'm here as a panelist, Shauna.
Okay, great.
Okay.
Great. So Judith Jones is going to be here to speak to the New York Health Act as someone who's studied it and can answer many of the questions that I cannot.
So Susan Beckley also.
Okay, great. Hi, Susan. Good to see you. Let's see here. Ruth Yarrow had signed up to do public comment as well, but I do not see her. So I'm guessing she might come later in the meeting. And then Fred Belfour. Hi, Fred. How you doing today?
Hi, good morning. Doing fine, thanks. Or good afternoon, rather. Sounds
Good.
like I got up late in the morning, which I did not. I really just signed up to be an observer. I'm happy to listen and have no more further time in the meeting time.
Okay, great. Fred, I know your daughter, and if I can honestly say, you look exactly like your grandson.
I hope he likes that.
I'm sure he does. I'm sure he does. Okay, let's go ahead and go to the update on the ERAP funding. Kit Kephart is our Commissioner for Department of Social Services. Hi, Kit.
Hi, Shauna. Thank you. And boy, I can't tell you the roller coaster that we've been on with this program. So I think everybody's been hearing a lot about this program called ERAP, which is the Emergency Rental Assistance Program. And kind of where we've been at, as people probably know, this program is funded largely through the federal government's Department of the Treasury. It's supplemented with some New York State money. And communities with a population over 200,000 people were provided funding directly from the federal government. And so they're a little bit ahead of communities like ours with populations under that. So that's kind of created a bit of confusion because some people were saying, you know, what's going on? Why aren't we moving ahead with this? But it has to do with that population size and the way that the money is being distributed. So we are going to receive our allocation through OTDA, the Office of Temporary and Disability Assistance. And until last week, we were actually being told that the ERAP would not be operational until later in June. The state is in the process of developing what they call a portal, which is basically a way to receive applications for this money. And they were thinking last week that it would not be open and up and running until late in June. But 3 impromptu meetings were scheduled with OTDA last week. And we are now being told that they are hoping to have the portal open, which will provide back rent and back utilities. They're hoping for that to be open by the end of this month now. So currently it's our understanding that we are going to receive about $240,000 to handle outreach and supports around applications for this program. We're currently in discussions with local partners around contracting for that outreach and the supports for helping people apply. The $240,000 are only the funds for the outreach and the application supports. New York State OTDA will be making all of the determinations of eligibility and distributing all of the funds for this program. So that will not come through us locally at DSS. We're currently waiting for OTDA to make final determinations and then to provide us with a contract related to the money. And as soon as we have that, we will be reaching out to this committee to likely hold a special session to look to potentially accept the funds along with the ESG CV2 money, our second allocation in that line that I'm going to discuss in just a minute, so we can hopefully expedite all of the ERAP services out to the community. So a couple of notes real quick about about ERAP in New York State, just to give people a sense of how is this going to help. Currently, the eviction moratorium, as people know, has been extended in New York State until August 31st of this year. And this is really good news, but it will still be really important to get those that are affected by COVID, and especially those that are facing homelessness potentially enrolled into the ERAP, so that people will be helped as soon as those funds fully come online. A few quick notes about how ERAP can help people. ERAP is there to help people whose household income is below at or below 80% area median income, which the ESG-CV2 program, or ESG-CV program rather, is there up to 50%. So this really covers a higher threshold for people. Anyone who received unemployment benefits or a reduction in income after March 13th of 2020 due to the pandemic is likely eligible for ERAP. Anybody who is obligated to pay rent or has rental arrears at their current residence after March 13th will be eligible for ERAP. And the household, if the household is at risk of experiencing homelessness or instability, which can be demonstrated by having those rental arrears owed after March 13th, they will likely be eligible. And then households that are eligible for rental arrears may also be eligible through ERAP for utility arrears. So it's a comprehensive support for people. The way that ERAP is being rolled out in New York State, the people, there's an initial 30-day period that will support, will prioritize households in the following ways. Households with income at or below the 50% AMI, and also include a household member who is currently unemployed for at least 90 days, is a veteran, is currently experiencing domestic violence or a survivor of human trafficking, has an eviction case, resides in a mobile home, lives in a community disproportionately affected by COVID, or lives in a dwelling of 20 or fewer units. All of those people will be prioritized for that first 30 days. And then after that first 30 days, applications for all eligible households will be processed on a first come, first serve basis for as long as the funds will be available. And then again, we will be making a big push to get the word out and to provide that outreach support. Like I said, we're going to be contracting for that, and we're still kind of working on that piece right now to make sure that community need is met. And so this program, the ERAP program, really is very similar and will work somewhat in tandem with the ESG program. So I want to just kind of quickly mention that the ESG program, which is the Emergency Solutions Grant through the CARES Act, which we have been operating now since October of 2020, is supporting people with rapid rehousing, rental assistance, and homelessness prevention up to that 50% AMI. And we have been, to give you kind of a picture of how this program has supported our community currently, that program has enrolled 70 people, 57 households, which includes 59 adults. Those 59 adults are without children, and then we have 3 families with a total of 6 children. The program has housed 21 households so far, which includes 2 of the 3 households with children. And we've spent about $94,000 or encumbered that money for rental payments through June of 2022 so far. And so we've got about 40 people that have been enrolled that are still looking for housing. About half of them are actively looking for housing right now. We're working with them and doing case management. There's some steps that always have to take place for people to fully engage in that housing search. And then in the area of homelessness prevention, ESG has assisted about 20 households, which includes 8 families with about 15 children. And about $134,000 has been spent so far or encumbered for those rental payments through June of 2022. And then, as I indicated, we're currently waiting for that second allocation of ESG CV2 money to come through OTDA. The reason I'm putting that ERAP and the ESG programs together and telling you about them both is because the ESG, we have contracted already, or OTDA has written a contract that we have already processed and have been up and running with this ESG program since October of last year. OTDA is anticipating that what they're going to do is actually roll the contracted ERAP money into our ESG contract, kind of put all those together, even though those programs operate somewhat separately. And the goal will be, once both of those programs are up and running, the goal will be to move everybody into the ERAP program that we can, and then support people with ESG funds that don't qualify for the ERAP. Of course, ERAP is federal money and the ESG is state money. So, so we're trying to, OTDA is pushing us to utilize that ERAP funding wherever we can. We're anticipating our second ESG allocation will be about $452,000, about that. So it's a lot of money. It will be a lot of rent for people to be able to get that support, and then to also kind of get the case management and other supports that go with that program. So I know, I think that's, most of the information I have about these two programs. I know that's a lot to digest. There's a lot to these programs that, frankly, it's taken us weeks to kind of absorb all this information, turn it into programming, and to think about how to apply it. So I'm not sure if people have questions or there's other thoughts.
Thank you, Kit, for coming in today and giving an explanation. It sounds like things are finally starting to get nailed down a bit. And I'm glad to hear that we're getting some of the details. I know that it hasn't been quote unquote secretive, but I know that the information's been hard to find. We do have questions, but I also want to remind my colleagues that we have a lot on the agenda today. Let's not get into the weeds on this topic. If we could ask just a few questions, and then if you have more specific questions, you can contact Kit independent of this meeting. Mike Sigler is first.
Hi, Kit. I just wanted to know, does this cover just current rents, or will this cover rents that are in arrears and things like that?
The ESG money covers rental arrears further back than the ERAP, but both of them cover rental arrears. They're going back to that date of March 13th, 2020, because that's really when they're seeing that the pandemic hit and started really affecting. That's when the majority of the job loss was, and that's when people were really impacted financially. So yes, it will cover a lot of that. That's the intent. It will also, the ERAP program will also cover a lot of those utility problems, the back utility payments that people weren't able to make. So it's going to be a huge support to people and bringing them forward.
Thanks, Mike. Martha, and then Leslie.
Go ahead, Leslie, she's on the committee. Go ahead first.
A quick question, and thank you, Kit, for this information. Do we have a sense if there's a limit for individuals or families for how much they're able to tap into these programs?
So as long as they qualify, my understanding is that it will, it does cover those arrears back to the March 13th date. And then typically there's a few qualifiers between ESG and ERAP, but it's going to be based on whether or not somebody continues to meet the eligibility criteria, which has to do with things like job loss and whether or not there are hardships. So otherwise it will support people with the intent of trying to get them back on their feet until they have that income coming in. And they will be able to be supported. OTDA has added a lot to their website. So if people are looking for really specific information, there's a lot to refer people to there. OTDA just brought it up last week. They have specific ERAP pages now on their website. So you can really check that out and get all of the details. Like if somebody's contacting you and looking for, will I qualify and under what circumstance, you can have them check that out. But we're also really encouraging people to talk with us here at DSS, or when we get that outreach piece in place, to reach out and to let people know that they need that they need help and that they have questions, and we'll try to make sure that everybody we can support in the eligibility criteria, we will. So
Thanks, Leslie. Martha?
Thank you, Kit. I know this is a lot, and it's only one of your many, many, many programs. Can you help me? If you could put together those numbers of who has helped in ESG, and just so it'd be great to have, I wrote them down as fast as I could, but does either of these programs, what's the relationship with the landlord? We heard that earlier programs, like the landlord had to apply or the landlord had to agree, or they're different. What's up with the landlords?
Yeah, so that's a really good question, Martha. It's and I didn't talk a lot today about how the landlord interface will work because OTDA is still working some of that out. But our understanding is that the client and the landlord will work together. OTDA is telling us right now, but again, I think they're still working out some details. They're telling us right now that that landlords and that a client can apply. It will require the landlord to basically acknowledge, to be able to be a part of it and certify that this person owes this money. However, OTDA is saying that they will hold that money. I don't remember how long it is, but it's a considerable amount of time until they can make contact with a landlord. So the landlord, even if the landlord is not, easily reachable and the client is saying, hey, I need help, there will be a hold there so that they will pursue the landlord. And the landlord can apply, but it will take both. Oh, Kathy just put in 180 days. I couldn't remember what the figure was. So it's a long period. And the landlord and the client will need to work together on that.
Okay, and if let's say somebody lost their job for the pandemic, but they've now gotten back on their feet, but so they can pay rent currently, but they still have an arrearage, they should still apply and they could be qualified.
Absolutely. Yep. Yeah, there are many folks that we are finding that that may have gotten back on their feet to a certain extent. They may have gotten a job. There's a lot of folks that we're seeing that are underemployed, compared to where they were before the pandemic, or maybe they were working 2 jobs to get through and they've gotten 1, but they're not going to make it. So there's a lot of different scenarios. Again, the state's going to be handling all of the eligibility, but we're encouraging people to apply. And they should qualify if they have that back rent, because that will, without payment of that will potentially put them at risk for homelessness. And I think I just saw, oh, sorry, Martha, go ahead.
Oh, you go ahead and finish.
I was just going to say, I think Ann Corman just put in the chat where would people find more information. I'll put the OTDA website, the ERAP website in the chat as soon as we're done talking, so that's available to people.
Okay, and just one more question. So if, I don't know whether we have any idea the true scale of the need. And, you know, I think the state's full pot is something like 2.3 billion, which sounds like a lot of money, but the need is pretty vast. Do we have any sense, and it might just be an educated guess, if anything, so there's no allocation that says Tompkins County gets 500,000. It's all first come, first serve into the state portal.
It is, they really have not reserved this based on, you know, on a specific location. But so it is first come, first serve, which is, you know, a big part of the reason that, you know, we're looking to kind of set that outreach up and try to get help where it's needed. I don't think we have a way right now to really determine all of what the need is. We don't, you know, it's one of those things, it's in a vacuum that you don't have a great sense until people come to you and say, you know, here's my concern. I've got this much back rent. And with the eviction moratorium continuing to be extended, it's very difficult to get a grip on exactly who's in need and in, you know, in what way. So yes, I think the best thing we can do is be there to support people. We have some sense that that the ESG program, as people have come in to access that, we have definitely seen need, and it's been a huge help. However, I don't think even with that program we've seen the floodgates open because that eviction moratorium is still in place.
So I wonder, I mean, it's really.
Martha, if we could move on because we have a long itinerary today.
All right, thanks very much, Kit.
Deborah?
Yeah, thanks, Shauna. And thank you, Kit. This is really helpful. I just wanted to nail one piece of it down. My understanding was that these funds would be paid to the landlord, and then the landlord would have to commit to allowing the tenant to stay for some period of time. Is that correct?
Yes, so it's yes, generally it will, the landlord will get direct payment, and the landlord has to agree not to raise the rent, to allow people to continue to live there and not raise the rent for a year, I believe is the period of time.
Thank you.
Yeah.
Great.
Sure.
And Kit, I just had one question. I know that the city received $1 million grant as well. Is there any coordination with DSS and the city of Ithaca so that city residents are applying for their pot of funding, and anyone that perhaps does not live in the city is applying for ERAP funding?
So, we're certainly aware of that pot of funding. I think that ERAP, my understanding is that ERAP would still be the first pot of money to be applied for. But I honestly, I don't know for sure. That pot of money, we've been so focused on ERAP and ESG right at the moment. I'm not sure exactly how these two will interface. I can do some work on that, although I believe that we would still be directing people wherever possible to rely first on that ERAP before it goes away.
Okay. I mean, I just want to make sure that we don't have city funding that's left there untouched, and people maybe in the rural areas, you know, 3 months down the road who don't have access to the same services.
Sure. No, that's a very good point. Absolutely.
Great. I see no other questions. Thank you, Kit, for giving us that update. We appreciate it. Okay, I see that Ruth Yarrow is here. Hi, Ruth. I saw that she was here for a second. Ruth, did you want to participate in public comment today?
Yes, thank you very much that I missed the chance. I just wanted to say that the Human Rights Commission and many others that I've spoken with feel very strongly that the New York Health Act would be an enormous boon to people in the county. And I hope that you will recommend that the whole legislature vote in favor of it.
That's great. Thank you, Ruth. And I think Leslie will bring something forward that will also make you pretty happy whenever we get to the resolution. Let's see here. I did see Mike Sigler's comment in regards to that he only received 2 of the public comments. Mike, we'll
I got
have,
the other two down.
okay, good. I just wanted to
Yep,
make
they
sure.
came through.
Just to make sure everyone has received, Carol Labori, Linda Finley, Kathleen Ian, and Jackie Jablonski were all four of the people that have written into the legislature in support of the resolution. Okay, real quickly for the chair's report, I would like to send a formal congratulations to our very own Frank Krupa. He received a very big award through the Chamber of Commerce for the Noel Desch Key Person of the Year Award. That is a massive, wonderful achievement. So let's give Frank a hand. Good job, Frank. Congratulations. Do you want to give a speech?
Absolutely not.
Okay, well, moving on. Frank's a humble guy. I also wanted to thank Ruth and the others for coming out today and helping me with this resolution. I've corresponded back and forth with many of the people on this call or on this Zoom chat. I also worked with a senior student named Tyler Collins from Lansing High School, who also helped draft the resolution. So I did want to send him a shout out too. He worked really hard on this. Let's see here. We also will be talking about the New York Health Resolution. And Mike Sigler also sent a resolution out to the legislators on this committee. And I guess in the chair's report, I just wanted to see, Mike, did you want to bring that forward as a formal resolution for this meeting?
I would, just because, you know, we're voting on this. I'd like to kind of put it in as a replacement. I don't know if it'll go second, but, you know, I can always put that in as the conversation too. So.
Okay. You know what? Why don't we do yours first, if that's all right?
Sure.
And we could, I'm happy to second it just for, you know, a conversation piece, and we could see where that goes. And then we will save the other resolution for after that.
Okay.
Okay. Let's see here. I also wanted to let people know that we still have the registry that is alive and well on the New York State Department of Health, or the our local website. And we have openings right now for vaccine. If you are interested in getting a vaccine or know of anyone that needs vaccine, we have plenty. And there's no need to necessarily travel outside of Tompkins County. I think that's it for me for the chair's report. Why don't we go ahead? I don't know how we're going to do this, Mike, because we don't really have a resolution number. And I want to make sure that all committee members have access to this resolution of yours. And no one,
Okay. I emailed it to everybody, so.
Yeah. I just want to make sure that Leslie, were you able to take a look at it? Okay. And Amanda? Okay.
Yeah, briefly, but yeah.
You know what, Mike, do you mind if we do this as a discussion and not a formal resolution?
However you'd like.
Let's do that. And then if you want to move it forward tomorrow as a member filed, I am happy to second it for you. So we can have the conversation.
Fair enough.
Let's just have it be a conversation piece for now. And do you want to bring it forward and introduce your ideas to us?
Sure. I mean, my thinking on it is just, you know, single payer, people can keep trying to do it. I mean, we've tried for 15 years, and I know people think, well, this will be the year we push it across the goalpost and the problem, or the goal line, excuse me. But, you know, we've had super majorities of people who say they want this for the past, 3 years now. And it just seems to me, even in states where they've tried to do this, like I know Vermont passed it, I know California passed it, and even though they passed it, they never were able to implement it. So my thinking is, why don't we do something that I think you can get pretty broad-based, you know, appeal to? There's not a single person in the country who hasn't been touched by cancer. I mean, cancer is the big thing, right? I mean, that's that's the one everybody worries about getting the diagnosis for. Pediatric cancer, you know, that's going to wipe out your family, and you've got to treat your kid. I mean, there's just so many things that go into cancer. And the thing about cancer is, too, we have real numbers for that, right? Like in 2020, there were 1,806,590 new cancer diagnoses in the country, right? That's a pretty precise number. And then we know that 606,530 people died of cancer. And then every year, New Yorkers, 110,000 New Yorkers are diagnosed with cancer. And we know how much it costs. The average treatment is about $100,000. So with that kind of data of cancer, New York State would be $11 billion. Okay, well, that's a real number. That's a number that the state can actually say, okay, we're going to put that in the budget. We're going to pay for treatment of cancer. And then you can go to the insurance companies and say, listen, we're going to take this $11 billion off your books. We want to see a return on that in lower premiums, because you're not going to be paying out that $11 billion. And I think you can get a lot of traction with that. And then some people are going to say, well, what about the other deadly diseases? Well, sure. You know, once we get this set up, then you go on to the next. But it just seems like if we just keep going after the same thing, I just don't think we're ever going to get there. I don't. And that's my concern. Whereas if you did this, you'd really help a lot of people, and you could help them, you know, because you have real numbers and you can budget for it. So that was just my thinking on this.
Okay, well, thank you, Mike. And I am actually trying to cut and paste your resolution into the chat, but it is for some reason not working.
I can do it.
Yeah, if you could do that, that way the people that are here and serving as panelists and that are here in the webinar. And I'm happy just to do a quick read of it too. In the meantime. So Mike wrote the resolution, whereas for 15 years, supporters of single-payer healthcare have pushed for versions of single-payer healthcare, including the New York Health Act, whereas they've met with zero success on the front despite having supermajorities of those claiming to support it in both the New York State Assembly and the Senate, whereas we recognize there are challenges to implement such a large change, and also recognize that in states where version of single payer have passed, including California and Vermont, these programs have not been implemented because of cost. Whereas we know that without healthcare, thousands die when they could be saved, while still more are in pain and could be treated, freeing them of pain, or at least that mitigating that pain. Whereas we need for a new approach to this issue, where we can arrive at more political and public buy-in, whereas cancer is a disease that touches everyone and is also a disease we can quantify. We know approximately how many people are diagnosed with cancer every year and the cost to treat them. Whereas in 2020, there were 1,806,590,000 new cancer diagnoses and 606,530 cancer deaths in the United States. Every year, 110,000 New Yorkers are diagnosed with cancer, whereas the cost of cancer care nationally is near $150 billion. Some estimates put the average cost of treatment at $100,000. That price estimate would put the cost of treating every cancer diagnosis in New York State at $11 billion. Whereas we recognize that is a high cost, but it is also a known cost that can be budgeted for. It is also a cost that the state can use to negotiate with health insurance companies to lower healthcare premiums, since the state will be taking $11 billion of cost off New York health insurers' books and giving them a known savings, plus the removal of instability of rising costs. That savings and the removal of the unknown should be reflected in reduced premiums. Whereas we understand that there are other diseases that cause pain and death, we also understand that cancer is the largest, affecting the most people, so we'll have the broadest appeal. Once it is established, it's anticipated that New York State will look at covering other diseases. Whereas we recognize this is the start of covering what's been a plague for centuries, we must start somewhere towards assuring New Yorkers that a cancer diagnosis is not a death sentence. Resolved, for these reasons, the Tompkins County Legislature calls on the New York State Assembly and Senate to put forward companion bills that would fully cover cancer treatment in the 2023 New York State budget. So that is what Sigler has put on the table here.
Well, you don't get the MVP for hockey playing, but you do get it for reading resolutions. That's
Hey,
that's
it's the
your
least I
MVP.
can do around here. Okay. Let's see here. So I am happy to add comment here. I see where you're going with this, Mike. And, I get it. Like, are we just, kind of beating a dead horse? Financially, what is this going to look like? Is it going to bankrupt New York State? I mean, it's kind of embarking onto the unknown, as far as the finances. And I think, Republicans tend to like to know the numbers before they jump in. And I'm totally stereotyping, but I think you'll agree with me. And so, and I get that and I respect that. From someone whose child has gone to Memorial Sloan Kettering and had a cancer diagnosis, the one thing that I would have loved to not have worried about was how to pay that bill or if it was going to be covered. I think that there is a pretty good chance that the New York State Health Act could pass this year. We've passed this resolution 5 times before in this legislature. And every single time, there are a few people that do not support this resolution. I personally think that people and New Yorkers not having to worry about insurance, I mean, quite honestly, me as an elected official right now, this is the first time in my life that I've ever had good insurance. My wife and I have always paid the $10,000 deductible for our 3 kids. And quite honestly, at times it has absolutely drained our banking accounts. And so for New Yorkers and their families not to have to worry about the copays, about being dropped by their insurance, about finding doctors that take their insurance, it's going to really be an investment in the people that live in our state. And so with that, I'm happy to second your resolution if you want to bring it forth as a member file tomorrow for the point of having the conversation with the full legislature, but I probably would not support it.
That'd be great. Thanks.
Are there any other comments from committee members? Okay. Leslie.
Sorry, I couldn't find the other raise of hand. Yeah, I understand completely where you're coming from, Mike, and I applaud the focus on the scourge of cancer. We too have had a similar situation in my family that Shauna just described. I do have good healthcare coverage. I don't know what we would have done if I didn't. But other people have other really bad conditions too. And I don't know that it's fair to separate, divide, and focus, even though we have many people focusing on the research to attend to and discover means to address and hopefully someday cure many, many ills. Cancer is a big one, and we could list diabetes, and we could list heart disease, and we could list so many others. And so it's hard, to pick and choose and pick our way through a healthcare program for people. So yeah, just wanted to share that.
Thank you, Leslie. And my situation's, it's interesting that you brought forth this resolution, Mike, because 4 years ago, my daughter was diagnosed with a sarcoma, which is a type of cancer at Rochester. We went to Memorial Sloan Kettering. She was 10 years old, went to Memorial Sloan Kettering, told that our insurance would not cover it, and ended up fighting back and forth with Blue Cross Blue Shield. Finally, they came around and said that they would cover it. Whenever they pulled out the tumor, they found out that it wasn't cancer. And so if you put such clear definitions on something such as we'll pay for cancer treatment, what happened, this is just a single situation that deals with my family, but what happens if they pull out the tumor and it's not cancerous? And many times they don't even know until they go in. So, my experience. So any other questions from committee members? Okay. Let's see here. if we could have a mover for the resolution, support for a single payer approach to controlling healthcare costs and ensuring everyone is covered, and urging the New York State Senate and Assembly to enact the New York Health Act, A 6058, S 5474, ID 10133, moved by Amanda. And can I have a second, please? Seconded by Leslie. And are there any questions or comments from committee members? Leslie?
Yes, I'd like to add 3 whereas statements.
Okay.
Might. And I'll read them and then I can put them into the chat for folks to see.
Great.
I'd like to add them at line 35. And this would be attending to the work of our advisory commission. They would read, whereas the Tompkins County Human Rights Commission is a volunteer advisory group appointed to the Tompkins County Legislature for the purpose of fostering mutual understanding and respect among all persons in Tompkins County. And whereas on May 10th, 2021, Susan Beckley of the Finger Lakes chapter of New York Health attended the regular meeting of the Tompkins County Human Rights Commission and presented an update regarding the precarious state of healthcare in New York State and the fact that rigorous financial review of the Act shows that under the 2020 New York Health Act, 90% of New Yorkers will pay less than they do today for healthcare costs. And whereas on May 12th, the Tompkins County Human Rights Commission, in their advisory role to the Tompkins County Legislature, submitted a compelling statement that culminated in, quote, calling on the legislature to approve a memorandum of support for the New York Health Act.
Okay, Leslie, you moved it, or Amanda, you moved it. Is that friendly?
It is. I guess sure, it is. I'll just say that.
Okay, and Leslie, you were the seconder. Is that friendly?
Yes, it is.
Okay. Mike Sigler.
So I just have 2 questions, really. I mean, Andrea Stewart-Cousins, she pulled this not just from, it's not like it passed out of committee. She actually pulled it from the committee agenda, which I think is kind of strange. I mean, it's not strange, but I'm kind of wondering if anybody knows why she did that. That seems odd to me.
Do any of our panelists? Yeah, Susan.
Oh, sorry. Actually, we don't know. I've been in communication with State Senator Gustavo Rivera, who is the sponsor of the bill, who is also the chair of the Health Committee. We have been taking numerous calls to her office in order to have her put it back on the agenda. We're perplexed as to why she pulled it off. In the 2017 and 2018 session, she was a co-sponsor on this bill. She's from Westchester, Yonkers, North Bronx. The other state senator, Shelley Mayer, who is also in the Westchester area, is a co-sponsor on the current bill as well. So it's unclear to us as to why she would intercede in committee agendas and pull this item. So they're working very diligently to get it back onto the agenda. The Health Committee meets at noon on Wednesday. It's the last Health Committee meeting for this session until next year. And we're trying to have it come out for a floor vote because there is a majority now in the state Senate, which it has not had in quite a number of years, let alone this is the first time that there's been a super majority of state senators with enough co-sponsors on the bill to have it pass the state Senate. It's already come out of committee in the Assembly. It's now in codes, which my understanding is it's sort of the ways and means of the Assembly. we are trying to get this to a floor vote before the end of the session, June 10th. So I put in the chat a phone number for Stuart Cousins' office. I spoke with them earlier today. Very nice, listened very attentively, and it was a very nice experience. So if people are strong proponents of getting this bill out for a vote and to the governor's desk for a signature, then please let people know far and wide to get in touch with Stuart Cousins, as well as Carl Heastie, who is the Assembly Majority Leader, and to have it come for a floor vote in the Assembly. It's an identical bill for both houses.
Thank you. Mike, did that answer your question?
I have 2 more questions, if that's okay.
Yeah, go for it. Oh, we can't hear you.
So if I understand this right, okay, how about now?
Yeah, a little better.
I'll make a nice happy face when I freeze. Okay, I'm just wondering, so with this, so insurance is like Medicare, Medicaid, this would cover all that. You wouldn't need those anymore because this would cover those, and we wouldn't need the healthcare consortium anymore because we'd be covered by this new state plan,
Well,
right? This
yeah,
new state program.
it's a matter of understanding. I think it's similar to what Kit was talking about earlier. This is a state program as opposed to Medicaid and Medicare that are federal. So we don't have any impact on federal legislation. So I think the easiest way to look at this is that New York State will be sort of a wraparound for these federally funded programs. What would happen is that the New York Trust Fund that would be set up would administer the implementation of payments for services. They will take all of the monies that are come from federal dollars, which cover nearly 2/3 of medical expenses in New York State, and they will be channeled through this fund. The rest of it will be paid through payroll and non-payroll taxes, just like we do for Medicare currently. Medicare won't go away, Medicaid won't go away, but this will fill in the gaps. For instance, there's not going to be any donut hole for Medicare recipients. There's not going to be copays and deductibles for Medicare people. There will be no networks. There's not a family, individual, group insurances. This will be an all comprehensive bill for any that covers any medically necessary procedures or visits. It's very similar to what other Western nations and certainly Asian nations have already in place. We're pretty much the odd one out here.
Sigler, your screen is frozen and it looks like you're sleeping in my meeting.
So people might be able to keep their private.
No. If you're a New York State resident.
Sorry, can you hear me now? How about that? No. Okay.
New York State will not have private insurance for any duplicate services that the New York Health Act would provide for. So, if you needed a tummy tuck, you could have that as a private insurance. Or if you had some other sort of plan, which you want a private room at a hospital rather than a shared room, something like that. Again, this is for medically necessary visits and procedures, including medications, mental health, rehabilitation, vision, dental, and hearing, as well as devices. So anything that's durable goods that are medically necessary. The state would negotiate prescriptions with pharmaceutical companies and will be responsible for paying those bills as well.
Okay.
Okay, thanks.
Thanks, Mike. Judith?
I just have one comment. I see Mr. Claiborne is here, And I've been told that the veterans would have choice between staying with the VA or becoming a recipient of New York Health Act care.
Well, Judy, my understanding is, yeah, they would have that, but once, if they are employed in New York State, they will be contributing to the New York Health Act regardless, or the New York Trust Fund, I should say, regardless of where they get their health care. So they can use the federal services and distribution of medications and all, but they can also use other services as well. I mean, part of it that I find really nice is there's no networks. So if your physician has a specialist that you want to see, for instance, like the Sloan Kettering example that we just heard about, that with no networks, those healthcare costs would be fully covered.
I just can imagine a vet who wishes to stay with the care system that they have in the vet administration, where the salary is paid in a different way.
Yep.
Yeah.
Great, thank you. Amanda Champion?
Yeah, thanks. This may not be a very popular opinion, but I sort of wavered on the amendment because I feel like this is a very long, very detailed resolution. And I recall, might have been one of my very first meetings as a legislator, and it might have been Mike Sigler who said he doesn't put a lot of stock in these resolutions urging the state. And that stuck with me. And somebody said, it's great to send these things, to say that we support them, but none of these people who are sending it to are going to read it. And I realize that's a bit cynical, but I support it. I would love to see the New York Health Act go through, but I don't think we're going to solve all those issues here. And I do appreciate, Mike earlier bringing up something else and pointing out the fact that this has, been trying to happen many times. And I guess feeling a little impatient with it, but that's just my 2 cents.
Yeah, good point. I think we're all impatient with it because for many people, we feel like this is a no-brainer.
Well, you have to realize, Shauna, I mean, if the healthcare and pharmaceutical industry throughout the United States is accounting for almost 18% of GDP, that's a huge, huge amount. That industry is the #1 profitable industry throughout the United States. It exceeds oil and gas. It exceeds the financial services industry in its profitability. And you're not going to unwind that very easily and quickly. There are 14 providers of private health insurance in New York State. Most of them are throughout the United States. If we can get this through in one state, then they can begin to unwind. They can change their investments. I mean, there's a lot of pensioners and all of those people who have investments in these stocks. These are very profitable industries. I don't think you're going to slam that all at once. So if we can do it in a statewide fashion, which Governor Inslee last week signed universal health care, single payer in Washington State on May 13th. So things are starting to move. That's the first time we've had a governor after it had passed their state legislature. So this is the first time that we've been able to move this bill because it's the first time we've had Democratic majorities in both houses. And the governor's a Democrat. So we will see. He has not been really on board about this, but on the other hand, he said that if both houses passed it, that he was inclined to sign it. So, let's see how this goes.
Right. And I agree, Amanda. These are, we kind of call them feel good resolutions, right? Like, they literally, I think Martha years ago said they read the first sentence and that's it. They read the top resolution and that's it. And so, whenever I was writing this resolution, I actually brought up Will Burbank's old resolution from, I don't know, 5-6 years ago, and, did a little bit of editing on his resolution. So I wanted to pay homage to our former colleague, Will Burbank. I did keep quite a bit of his initial resolution. Okay, let's go ahead and vote on this. Leslie Shill,
Yes.
Mike Sigler,
No.
Amanda Champion,
Yes.
and I am a yes. So that goes out of committee with a 3-1 vote. And we will present it to our colleagues tomorrow at our 5:30 legislature meeting. Thank you, everyone who has joined us for this discussion. We appreciate your expertise and your help on this topic. Thank you. Okay, let's move on. We have a county administrator's report, and Amy Hendricks is here for that.
And I'm going to keep it short so you can continue to go under. I don't have any report this time. I'm sure if there's any COVID-related questions, we have Frank on as well, so he'll be able to help out there. So I will skip the report for this time.
Great, thanks, Amy. Next is a presentation, and that presentation is going to be a public health presentation on gun violence, ID 10128. Frank, did we catch you mid-lunch?
Chewing gum, sorry.
Oh. It's all right.
So I'm going to share my screen if that's okay. I've just got a handful of slides. Let me get this into a slideshow, I think. There we go. Are you guys seeing the slides?
Yes.
Great. So you know who I am. I want to start by offering, I'm not a gun violence expert. So everything we're talking about here today is information that Samantha Hilson, Ted Shealy, and myself have been able to kind of research and pull together. And it's really just a starting point for any conversation that we might want to have. So obviously any questions or discussions that you all have subsequent to the presentation, we'd be happy to try to dig further into, details around information. It is a bit challenging to find data around this issue. There is the pretty standard cause of death data that's out there, but much of the rest of it comes from nonprofit and other organizations, and not necessarily government, because obviously there has not been a lot of research done on gun violence at the federal level. So we're going to share what we've found. We'll also share a little bit about what we know about New York State and data, and then locally as well. So U.S. firearm deaths, more than 39,000 each year, with 85,000 plus injuries as well. In New York State, there's over 2,700 violent deaths per year, which include homicide, suicide, and unintentional firearm injuries. We know that gun violence disproportionately affects young adults, males, and racial and ethnic minorities. And probably the most, probably one of the themes that we're going to see through this is that suicide is a big player in the gun deaths in the United States. And obviously, being the mental health commissioner, I'm going to want to focus on that a bit as we go through. So we pulled out some data from the CDC that we could find, and the first chart here is all deaths. So we wanted to kind of get a feel for, what are the leading causes of death in the United States, and you can see the top 10 here, and suicide comes in at number 10. And I think it's important to show that, because when we talk about gun violence, you're going to see that there's a significant portion that contributes to suicide. So in the chart next to that, just to kind of give some context, we pulled up motor vehicle traffic deaths, and you'll see that there's about 37,000 and a half each year, or in 2019 at least. And our firearm deaths were just over that at 39,700. When you go down into the suicides, all suicides, we had 47,000, but firearm suicides were just under 24. So essentially what we're seeing here is that 50% of all suicides are completed with firearms, and 60% of firearm deaths are suicides. So we absolutely have a concern here, and I think as we're talking about gun violence, we very much need to be talking about depression, mental illness, and suicide as a key area of focus. So New York State has begun a violent death reporting system, albeit not very complete at this point. We went looking, and their first year of data collection was 2015, with the anticipation that in 2017 the data would be available. And I don't know that the data is yet available. So Samantha Hilson and Ted went digging to try to find it, but we weren't able to get there yet. So hopeful we'll be able to see that soon, as New York State is starting to hopefully put some prioritization on the data. So we went into our medical examiner information and did a summary of our deaths related to gun violence between 2016 and 2019. We had 3 here in Tompkins County, 3 homicides where someone was killed by a firearm that was operated by someone else. And since 2016, we've had 11 suicides via self-inflicted gunshot wounds. So even here locally in our data, you can see that suicides are the key impact on gun violence in our community. We have this other data set that's it's called the Kids Wellbeing Indicators Clearinghouse, and it has a lot of different data, and it was one place that we were able to try to find some information about where we are and what we've seen over the last years on crimes particularly known to the police and related to firearms. So this goes above and beyond just deaths that would be associated with firearms, but crimes in general, which includes, it says in the footnote there, murder, forcible rape, robbery, or aggravated assault. And so you can see over time how it's moved here in Tompkins County. We don't know what happened in 2017 yet, and I'm assuming the 2018 data is just not available yet. But you can see that we've certainly seen some ups and downs, but starting in 2015, the numbers were trending up until the 2017 blip there. I think one thing to point out that they did footnote that when the rates are less than 20, it does, it becomes unstable in the data to really see. So it is challenging when you get down to the county level to really see data that can be consistent and really tell the story. We wanted to do some comparisons. So we did a quick check in the same quick database. Rest of state, you can see obviously crimes known to police are significantly higher than they are here in Tompkins. But then we threw Cortland in just as a comparison. You can see our numbers have been higher than theirs and actually trending in opposite directions.
Excuse me, Frank, can I just, sorry to interrupt. Is that the rate per 10,000 people in the population?
Yes.
Okay, thank you very much.
Yep. So we do collect some information here locally. I think you all know we do the survey of students here in Tompkins County, grades 6 through 12. The last time that it was administered was 2018. I think it was due for 2020, but obviously with COVID, that didn't happen. And so we do ask about access or interactions with handguns. And we ask these 3 questions. Think of your 4 best friends in the past year. How many have carried a handgun? What are the chances you would be seen cool if you carried a handgun? And how many times in the past year have you carried a handgun? So this slide shows you the data that came from those questions. You can see pretty significantly across the board for all 3 answers, folks, the children said none. I think the one that's probably most disconcerting is the second question, would you be seen cool? Those numbers are higher than the others. And so, obviously there's an opportunity there to influence perceptions around handguns. So I think the bigger question for us, as I started with, there's a lot of different issues around handguns, around gun violence, and wanting to be able to figure out a process to begin to identify what we could do as a community. There's a public health model that anyone that's studied public health is familiar with from the CDC. Obviously, you got to find out what the problem is, identify the risk and protective factors, develop your interventions, and then once you've identified they're successful, then assure widespread adoption. So, I think the opportunity here for us is to think about how we might approach that here in Tompkins County. The American Public Health Association talks about a kind of a 5-step process to prevention of gun violence, needing good surveillance, which I think is a big first step that still needs to be taken. We need data, and we need federal and state data along with local data to be able to track, because our numbers are often small enough, while still enough to need attention, but they're small enough that it's hard to make any strong determinations about what is going to have the biggest impact. So we need that state and federal data to help guide us, as we're addressing things locally as well. Obviously, we want to talk about risk factors, and that goes back to, much of gun violence is associated with suicide. And we know that we have opportunities to address the risk factors for depression, deaths of despair, poverty, and such that can impact individuals. We want to figure out what we can do as a community to guard against those gun violence incidents. Obviously, develop, implement, and evaluate interventions, and then institutionalize those prevention strategies. So this is pretty straightforward kind of public health approach to dealing with preventable injuries, illnesses, and deaths. And I think the same thing applies with gun violence. And we want to always be thinking upstream as much as we can. I know there's obviously a lot of public conversation going on about guns themselves as the tool, but I don't want us to lose sight of those upstream social determinants that lead often to the situations where gun violence becomes the solution that an individual takes, unfortunately. So. We're gonna, if the legislature wants to continue to have conversations about how we might go about this is kind of the framework that we on the public health side of things would propose that we looked at. So that is my quick run through of what we know. I'm happy to try to answer questions, but really interested in any discussion and future directions that you guys want. Would like us to look into.
Great, thank you, Frank. I know I asked at the last HHS meeting for you to come and do a presentation, and I realize this is kind of new conversation that we've started, seeing as this being a public health issue, and my interest actually came from there was an NPR special that included an emergency room doctor who had been studying this for so many years and was growing frustrated at the fact that it wasn't being seen as a public health emergency. And I think she said for the first time ever, the NIH is actually spending money on researching gun violence as a public health issue. So I thought it would be nice to have you in. So thank you very much for the presentation. Mike Sigler?
Hi, Frank. I'm going to leave my camera off just because it seems to help with the glitches. But my question is about, and I don't want to seem like I'm nitpicking the word violent. I'm wondering if somebody were to overdose on pills and that's how they commit suicide, or if they were to jump off of the bridge and if that's how they commit suicide, would that be considered violent? Like, would we classify that as violent?
Not in the definitions that we were looking at, Mike, and I agree with you. Sam and I were scouring the internet to try to understand where what a violent, what violent meant in terms of this data, and it really was just connected to gun violence. And I don't know that I would hang my hat on the word violent. To me, a death is a death. What we're trying to understand is the potential causes and means that were used or inflicted in order to identify potential solutions. So I agree with you. I wouldn't, that wouldn't be my choice of words, but it is how the data is defined.
Okay, thanks. And I want to tell you, I really appreciate your focus on suicide. It's, I mean, the numbers really are startling. I mean, I already knew them kind of, but it was nice to hear them again. And thank you for that focus. I appreciate it.
Amanda?
Yeah, I agree with that. And thank you, Frank, and all of you who worked on this. I feel like I know that there is a suicide hotline in our county. Is that true? And who operates that? And how do people find out about it?
Yes, we do. We have a 24-hour suicide prevention and crisis services line. Our local suicide prevention and crisis services agency operates that. They've been here for many, many years, and they actually cover the entire region. And they do an amazing, amazing job of supporting folks. In fact, we use them as a tool in our mobile crisis team responses as well. So we do have a local resource here. They have struggled for funding for quite some time. Tompkins County actually, you all provide them funding each year, but none of the other counties in our region which they also serve do. And so it's a perpetual struggle for resources for them. So we absolutely, want you to be aware that we have an amazing organization here locally. But quite frankly, they can help, but we need to get upstream, right? By the time folks are calling them, typically they're in a crisis situation, and we really want to get upstream from that and prevent those crisis calls from happening to occur. But we have a great team here that does suicide prevention crisis calls.
And then I just had one other question, which is not really fully formed, but you had the stats from that survey from kids, and I guess I just wonder, like, what we're doing, what the health department is doing, what other organizations are doing, which I don't really know, about getting into schools and talking to kids about guns and gun safety and that sort of thing. Is there any hope on that horizon?
I like to think there's always hope on every horizon, but I don't know for certain what conversations are happening in the schools around guns and gun violence. I just don't know the answer to that. We can certainly check and let you know what we find out.
Okay, thanks.
Thank you. Mike Sigler? Mike, do you have another?
I thought I put my hand down. Sorry about that.
All right, thank you.
I'm good.
Great. And I know one thing that they've actually added to my pediatrician's office questionnaire for the annual is Does your house have guns, and are they properly stored? And that's something new that I noticed actually just this year. So I was glad to see that. Okay.
And I, just obviously we can't not talk about the idea that whenever we're dealing with talking about gun violence, there is concern about overreach and what that might look like. And even those questions in the doctor's office are not without controversy. There are many parts of the country, and probably here in New York, where folks are not happy to be asked that question. And obviously, from a public health perspective, the numbers show us we should be asking about safety around everything. They should be asking if you have a swimming pool, and do you have the appropriate safety things around a swimming pool or a water body. So in your doctor's office, we're looking at it from a health perspective. But obviously, whenever we're talking about these situations that are controversial, for lack of a better way of describing. I think we have to be mindful of that. And when we have these conversations, we have a lot of people that have strong feelings on both sides of it. And what we're trying to do is find that middle ground where we can agree that we have a problem and we need to think about solutions on how to fix it. And it's not one way or the other way. It's how do we come to something that we can all agree on that will actually make an impact.
Great. Thank you, Frank. Okay, I see no other questions. Let's move on to our resolutions today. First resolution, or second resolution, authorization to amend project budget, State Septic System Replacement Fund Program, ID 10102. If I could have a mover. Moved by Amanda, seconded by Leslie. And Frank, can you talk to this resolution?
Sure, this is an extension. This is not the new program where we applied for the CDBG funds. This is the program that we've had for a couple of years now. It's actually a matching program. It's a 50% up to, I think, $10,000. And we've had some pretty good success with people taking advantage of replacing their septic systems. They do have to be connected to the watershed in a way that I'm not going to be able to describe effectively, but our EH folks are right on top of that. And it's been successful for us, so much so as they've given us more money, even more than what we got the last time. So we're excited, not sure we're going to be able to find enough people to necessarily use it to its fullest, but we're definitely going to try. So this is just accepting those funds so we can continue that program.
Great, thank you. One of the questions that was asked is there a time period for these funds to be used?
That is a good question. There is a time frame. I think it's a year or two. I don't know that off the top of my head, but I can ask EH and get back to you.
That's great. And then, and this is on consent. So just an email would be great, Frank, and I'll forward it to the legislators. And then the other question is there a certain percentage of the total that it pays for?
Yeah, it's 50%. I think that's actually in the resolution. I thought maybe
Okay.
It's 50% up to a certain amount.
Okay.
So it is a matching program. It doesn't pay for the total. So there is an outlay from the homeowner. These systems can be expensive, and so it's that 50% can be the difference between a homeowner being able to do it or not.
Yeah, sure. Okay, thank you. Let's go ahead and vote on this. Or actually, are there any other questions or comments? See no hands. Let's vote. Leslie?
Are we just voting on to accept the report? I guess I don't understand.
Yeah, we're voting on to accept the funding for the septic replacement program.
Oh, sorry. Yeah. Okay.
Okay. Leslie?
Yes.
Mike Sigler?
Yes.
Amanda Champion?
Yes.
And I am a yes. That passes unanimously. Thank you, Frank.
Yeah,
Next
Shauna,
resolution.
and just in the
yeah.
notes on that resolution, it's 50% up to $10,000.
Okay, great. Thank you. Next resolution, reappropriation of funding received in 2019 and 2020 to the 2021 budget for the Learning Resources Grant from the Kresge Foundation, Public Health Department ID 10121. If I can have a mover, moved by Amanda. If I could have a seconder, seconded by Leslie. Would you like to explain this resolution, Frank?
Sure. This is a secondary grant that we received from the Kresge Foundation, originally to help support testing in our homeless populations. And fortunately, we were able to do that with other resources that became available. So we asked Kresge and they allowed us to reallocate these funds to help our health, support our health ambassador program. So we brought on 4 or 5 project assistants under the health ambassador role, and they've been out. Their primary function now is getting folks signed up for vaccinations. So they're going door to door, talking to community partners and leaders, and trying to get folks registered. So this is just shifting those monies to allow us to use those grant funds.
That's great. So as far as funding positions, will we be able to continue to keep the people that are in these roles?
So these are project assistant roles, which are time limited to 18 months to begin with. We don't have enough funding for 18 months. So they were brought on with the understanding that these are relatively short-term positions because it is grant funded. So it's not intended to be long-term.
Okay. Are there any questions for Frank? No? Okay. Let's vote. Mike Sigler,
Yes.
Amanda Champion,
Yes.
Leslie Shield,
Yes.
and I am a yes. That's unanimous. Thank you. Resolution, Budget Adjustment Community Health 4016, ID 10122. If I could have a mover. Moved by Amanda, seconded by...
I'll second it.
Hey, Mike Sigler. Frank, can you guide us through this?
Sure. This is a grant that we got from the state for $306,000 for temporary nursing staff that we've had employed since last year. We're moving that, we received it last year. We're moving the remainders of it to cover 2021 costs. We've spent, in 2020, we spent about 75,000 of it. This year, so far in 2021, we've spent 136,000 of it. So we have roughly about 95,000 left in that amount. We have traveling nurses that are with us that we love, that we're going to be sad to see go when their time with us is done. So we have the 95,000 remaining in that fund. It does run through June of 2022, but we will have used those funds up by the fall.
Great. Any questions for Frank? I see no hands. Let's vote. Mike Sigler, Mike, would you like to
Yes.
vote for this? Okay. Amanda?
Yes.
Leslie?
Yes.
Okay, and I am a yes. That's unanimous. Thanks, Frank. And any other updates from the health department?
Just the quick COVID update. We're doing a lot of effort with the children now. A lot of kids are going to get vaccinated in the next couple of weeks. Northeast Pediatrics was able to get a bolus of Pfizer vaccine, which is 1,170 doses. We got a bolus of 1,170, 800 of which were made available for this coming Saturday at the mall. I think we still have about 80 slots left there. So if you have a child 12 and up, please get them registered. We're also going out to Dryden on Wednesday and Newfield on Thursday. And then next week, we'll be doing 2 different clinics at Ithaca High School. They're going to bring their kids to us because they have the different cohorts in the 4 different schools. So we're going to be having 4 clinics actually in the schools over the next 2 weeks, coupled with the mall and Northeast Peds. So making some good progress there. Anyone 12 and up, wherever Pfizer is offered, can go, so they can seek out a state site. Some of them still have Pfizer, some of the pharmacies have Pfizer. So we'd encourage folks to look around or come to one of our.
Great, thank you, Frank. Mike? Mike Sigler, do you have a question?
Well, we can't let Frank escape without the governor's news from this morning about masks. So we can't let Frank escape without the news from this morning about the governor and masks. So I didn't know what his, if he had anything to say.
Frank? any
Yeah,
comments?
so if you haven't heard, the governor said effective Wednesday, New York State will be following the CDC guidance on mask wearing. And so vaccinated individuals will no longer need to be masked. So I will say I'm supportive of this change. I wish we were in a different place where these type of decisions were something that were communicated out over time, that there was transparency about why they were being made. And we had been on a path from, a year plus ago saying, this is what we need to do to get to this point where we won't be so separated, and then we won't have to wear masks so much and all of that. But unfortunately, that's not where we are. But I do agree, we need to be moving towards some normality. We need folks to get vaccinated. So hopefully this creates incentive for some folks that might have been on the fence. Our tool left is vaccinations at this point. At some point, we have to get back to normal, interacting with each other and being able to move about, be dense, and have our lives be what they were. But the tool that's left is vaccination. Disease numbers are down. We need people to get vaccinated. Herd immunity, quite frankly, for the country is probably out of the question. It would be very challenging for us. There'd have to be a change in public opinion across the country, a pretty significant one, to achieve that. So really what we can do is protect ourselves and our families by getting vaccinated, be mindful of hand hygiene, stay home when you're sick, cover your cough. The things we started this whole thing with are basic public health hygiene things that we need people to be following. And we'll continue to navigate these guidance changes as we move forward. But all in all, I think we're moving in a good direction, and it's an important step to take. And we'll take up getting vaccinated.
Thanks, Frank.
Did they
Leslie?
cover any,
Mike?
did they do it? Oh, sorry. I was just wondering if they did any new guidance on kids playing outside in masks. Or is all the kid stuff still in place? Or
Yeah, well, kids generally aren't vaccinated. And so, the CDC guidance is related to vaccinated people. So I think until we can get, a larger proportion of our children vaccinated, we're still going to be seeing the mask wearing for them, both indoors and probably outdoors, just because the control around vaccinated and unvaccinated folks is a bit challenging right now.
Thanks, Frank. Leslie?
I just want to say thank you to Frank and your team for all of the pop-up clinics and the different means and ways and basically great curiosity you all are showing and creativity in finding and talking to folks and figuring out how to get out into the community. I'm very supportive of the youth vaccination push. I'm glad that you're coordinating with the schools. I would urge folks that are downtown that have been looking for downtown opportunities that are walkable to check out your local pharmacies. I can tell you McKinney's downtown still has a lot of vaccine for children aged 12 plus. So they have Pfizer, and there are other downtown locations like that people can take advantage of if you don't have transportation, if you can't get to the mall. I know that we're offering those opportunities, but sometimes timing is an issue too. So there is a lot of vaccine out there. Please avail yourself of the great resources on the health department site and check out your local pharmacies as well.
Thanks, Leslie. And Sam would be very unhappy with me if I forgot to mention we do have office hours coming up tomorrow, one in Spanish, and then one with local pediatricians. So parents that are out there that have questions about their children and the vaccine, the office hours will be available tomorrow, and we record all of those, so they'll be available on our YouTube page after via recording. So check those out. Sam put the link in the chat box.
Frank, I had a question in regards to the vaccine, and I continue to ask this question. I think it continues to be unknown. The vaccine booster, how long is this going to last? Are we just all of a sudden going to start realizing more and more people are getting COVID? And that will mean that it's time for people to start getting vaccinated again?
So there are clinical trials that go continually. So part of the full FDA approval is understanding how long the vaccine lasts for. And then so the first folks that received the vaccine during the clinical trials that got the EUA are being followed, and they're being checked, and they're doing titers on them to find out if they still have immunity. So that work is ongoing. It will probably feel like a switch got flipped, because at some point we'll hit it where enough people that they're testing do no longer have immunity, and they say, okay, now it's time. We need to go into a booster from here. And that also coupled with the variants and understanding how the vaccine works with the variants as well. So it's not, the science isn't going to be the flip of a switch. It's ongoing. But when the science says, okay, now it's time, it's going to feel like we're just saying, okay, you got to go get a booster if you're at this point since your last vaccine.
Okay, thank you. Okay, let's see here. Why don't we go ahead and do the other things that committee members have to vote on, and then we will do our departmental updates. We have some appointments for the Substance Abuse and Mental Health Subcommittee. For the Substance Abuse Subcommittee, Ronald Harris, who's a community member, and his term expires 12/31/22. Molly Murphy, community member, term expires 12/31/24. Mental Health Subcommittee, Joseph Strayhorn, MD, community member, and his term expires 12/31/24. Can I have a mover, please? Moved by Leslie, seconded by Amanda. And are there any questions or concerns? If there are concerns, we can definitely go into executive session. I see no. And let's go ahead and vote. Leslie Shield?
Yes.
Amanda Champion?
Yes.
Mike Sigler?
Yes.
And I am a yes. Let's see here. We have minutes from April 19th, 2021. If I can have a mover. Moved by Amanda. Seconded by Leslie Shield. And are there any questions or comments or changes for the minutes? I see none. Start with Mike Sigler.
Yes.
Amanda Champion.
Yes.
Leslie Shield.
Yes.
And I am a yes. Okay, let's do some quick departmental updates. Let's see here. J.R. Claiborne from the Director of Veteran Services. Hi, J.R. How you doing? Oh, you know what? J.R. was going to have a delivery today, probably around exactly this time. So that was very bad timing on my part.
Yeah, he put something in the chat that he stepped away.
Okay. Well, let's move to Kit. Hi, Kit. How you doing?
I'm good. So most of what has been happening at DSS, you have heard about, because the ESG and the ERAP programs. Last week, I kind of felt like I had a million other things to do and focused on that almost exclusively. So so that is most of what we've been doing. I will say the other thing that we are pretty excited about is we are in the process of having all of our staff do another round of training related to kind of diversity and inclusion and implicit bias training. So so we are working with Belisa and Gonzalez through Ithaca College to do some processing post-training, but the training that we are having people go through right now comes to us from New York City ACS, which ACS is our, it's Child Protective Services in New York City. So we're using a module of training from them that we're pretty excited about having everybody go through. So that's probably the bulk of what's going on at DSS these days.
Sounds great. Thank you, Kit. Any questions for Kit? I see no hands. Welcome back, JR. Of course, during the 1.5 minutes that you were gone, I called on you.
Yes, that's just my luck.
Yeah, my luck too. What's going on with Veteran Services?
All right. Well, thank you and hello to everybody. Happy Monday. Hopefully it's going well. Just a few things happening. This week we do have no, I'm sorry. This week we have our virtual Veterans Coffee House, which will be this Thursday, noon to 2, and it will be via Zoom. Also next Thursday, we'll be doing our Warrior Writers, again, 7 to 9 p.m. That'll be also during Zoom. Last week, I was able to attend the burial for for the late William Bibby III, who was a United States Air Force veteran and also our county's first Black deputy. I was able to attend that, and also with Deanna Carruthers, our Chief Equity and Diversity Officer, we presented Mrs. Bibby, his wife, framed a copy of the resolution that the legislature passed in March. So she really appreciated that and wanted to say thank you to everyone. Also the thing that's taken up my time, but took up a bit of time, but it's good to be in hand, is we've got the flags ordered for the Memorial Day distribution so that our veterans organizations can put out the flags for the cemeteries throughout the county for marking the graves of our veterans. That's something that's coordinated by the VFW and done in cooperation with the American Legion posts around the county, as well as the Vietnam Veterans of America posts. Also, I've been, well, probably Reverend Ken will talk about this too, but myself, him, Deanna, who's called us together, and some members of the legislature, mainly Leslin and Henry, have been involved with folks from the city in planning some festivities for Juneteenth, for the coming of the Juneteenth celebration. So you'll be hearing more about that as time comes, which is moving very quickly on us, but we're having fun. And later this week, I'll be attending the GARE conference and annual meeting. I think there's quite a few of us who will be going. I know a lot of folks with Team Jedi are attending, but looking forward to that. And lastly, I just want to give a real nod as well as a plea. It's a nod to the county clerk's office and her staff. They provide a service of allowing our veterans community to file their documents, their discharge documents. I can't tell you how great a service that is. It's become very, quite obvious in the last couple of weeks, because we've had people who have needed, for various reasons, all emergent reasons, for having their DD-214s, and a lot of people do not. The thing about having it on file with the clerk's office, as long as they have the original with the seal on it, they're able to provide a certified copy for anyone who needs it. And this has been, in particular, what it's been needed for is funeral services and burial to get veterans benefits, for veterans who are applying for any kind of benefits. Those are the things that are most important. Aid and attendance is something that we get calls on quite a bit. And I can't tell you, under COVID, the National Archives, which is where those documents normally come from, as well as the Department of Defense, they were shut down at one point, and then they opened up to only for urgent matters. And they've been able to do a limited reopening. So they have a huge backlog. So it's not, before it took you roughly 6 to 8 weeks to get your discharge documents if you ordered it. Now there's no real time frame because of the backlog. So I really urge that for our veterans community to, for those that have their original or have at least have their DD-214 that has the seal on it, to please get it filed with the clerk's office, because you never know what emergencies may come up. You never know what other things may come up where you need this on hand. Quite a few of our folks do have theirs at home, and they put it away carefully. But this is something that it's a service that is offered through our county clerk's office that really becomes invaluable at times when you don't expect it. I do want to thank them for that, and I just want to let everyone know how great a job they do at it. They've been an immense value to me when I've needed to call and check with someone about theirs. But I really urge everybody, and please, legislators, if you have folks who talk to you about, or veterans actually, veterans and their families who talk to you about veterans issue, please ask them and urge them to put their DD-214 on file with the clerk's office.
Great, thank you, JR. Any questions for JR? Okay, thanks, JR.
Thank you.
Reverend Clark, good to have you today, Office of Human Rights.
Yes, good to see you and good to see all of you today. Excuse me. Just a few things to mention. In April, we saw an increase in inquiries for the office. Our best numbers, in fact, since January of last year. Excuse me. We had a total of 68 inquiries. And it sort of corresponds with what have been historically patterns that we see in the early spring, in which we see an uptick in inquiries. In some ways, based on what typically would be a normal year, but we've had anything but normal. Excuse me, over the last 14 months. We did see an increase in inquiries and a particular uptick in housing inquiries as well as employment as well. We've been involved in a number of programs over the last month. We did 2 fair housing programs, one on April 22nd called The Journey of Fair Housing, which focused on source of income discrimination. And I was part of a panel that addressed that issue along with Sally Santangelo from CNY Fair Housing, which partners with us, a Buffalo-based group called Housing Opportunities Made Equal, and the New York State Division of Human Rights. State Division has did a focus during Fair Housing Month on each of the sort of geographic quadrants of New York State, and they partnered with county and city human rights agencies in those quadrants to do a focus on fair housing and in particular source of income discrimination. We did a second program, which happened just last week on May 11th, or rather I should say May 12th, on developments and changes in fair housing, which we co-sponsored with CNY Fair Housing. And in that event, Sally addressed federal and state updates related to affirmatively furthering fair housing and disparate impact, and basically talked about the re-emphasis on these 2 areas of fair housing, which had really were being in certain ways dismantled or challenged under the previous presidential administration. We also hosted a community conversation on April 26th called After the Verdict in Minnesota, which we co-sponsored with GIAC and Clock, and which really was a very powerful experience as people shared their perspectives on the conviction of Derek Chauvin and the murder of George Floyd, and really ongoing conversation about how we address this issue of police violence against Black and Brown communities, and so it was a very very powerful discussion that took place that day. Last week, I was a panelist on a presentation on equity, health, and wellness that the age-friendly, Tompkins County Age-Friendly Center for Excellence, which Lisa oversees, helped to organize. And I spoke specifically about equity, health, and wellness from an equity perspective. And I was joined by Esther Greenhouse, built environment specialist, and an environmental gerontologist, Sam Hilson, and Lisa for that program. Upcoming programs we have, and I'll end with these. On May 20th and May 24th, we are co-sponsoring with the Ithaca Asian American Association bystander intervention trainings that are being sponsored by Hollaback that are focused on stopping Asian American harassment and xenophobia. These 2 events will be followed up by half-hour debriefing sessions, which will be facilitated by members of the Ithaca Asian American Association. So that's on May 20th at 5 p.m. and May 24th at 4 p.m. So that's what's been going on with us and what we're planning on doing for the rest of this month.
Great. Are you doing anything for Gay Pride this year?
Yes, we are in process of developing that and getting some input in terms of, what might be a good programmatic offering. So we're in the process of planning that for next month.
Great. Thank you, Reverend Ken. Any questions? I don't see any hands. Thank you very much.
Mm-hmm.
Lisa Monroe.
Hi, how you doing?
Good.
Great. And I'll just start off by saying thanks, Dr. Clark, for joining us last week for our final, Zoom call, I guess it was. It was our final work for our Center for Excellence age-friendly grant that ended. So we went out with a bang with all our county staff. So that was great.
Thank you.
Yes, thank you. And the only other things I was going to mention is that May is Older Americans Month. The theme this year is called Communities of Strength. There is a press release that went out and it can be found on our website. I'll put the link in the chat if you're interested in knowing a little bit more about it. But typically this time of the year is when we do our annual luncheon and when we celebrate our outstanding volunteers. We're not going to be doing that in person again. We are going to be celebrating them in the end of September. And NYSOFA, the New York State Office for the Aging, will be doing a recognition event at the state level in the beginning of October. So there's more to come on that. And other than that, we're just, we're kind of looking at our reopening plan at this point and looking at the county budget. So I'll leave it at that.
Great. Thank you, Lisa. Any questions? Okay, I see none. Thank you.
Thank you.
Kate Shanks Booth, Director of Youth Services. Hi, Kate.
Hi, how are you guys doing? Yeah, so I'll be, hi, Amanda, see that thumbs up? Yeah, so I'll just give you guys some brief updates. So we are trying to plan out the next training series for the Youth Services Department. Dealing with summer camp has been a big thing. And one of the things that has come out of those conversations is the mental health aspect of kids coming back. Some cases they've been, remote learning for a better part of a year or a significant part of a year. So how to have those conversations, how to have safe space, but then also how to help staff reduce their own anxiety and model that behavior is they're also coming out of situations where maybe they have not been working or been working at a limited capacity or different spaces. And so that is something that we're looking at. Internet safety is another thing that we're looking at as youth continue to be online. There's a lot of different things that are happening and it's something that we've talked about before, but I think it never hurts to reiterate that and to bring that back. So those are the things that we're looking at in the next couple of months. One of the major things that I wanted to update you guys on, I had mentioned probably I think once or twice a few months ago that the Runaway and Homeless Youth program that was operated by Family and Children's Open Doors closed at the end of 2020. And so we have not had, they were responsible for, the demographic was 12 to 16, 17, and respite, providing 1 to 3 days stay typically for youth who needed to be away from families with the goal of reunification. And so over the past, since that came to light at the end of 2020, we have had several conversations with different local nonprofits to try to see if we could find a home for that. Due to COVID, the size of funding that we're talking about is not significant enough necessarily to run an entire program, especially when you deal with a 24-hour hotline. This program is typically staffed by 1 or 2 individuals within an organization, so it's a capacity issue. They also do a lot of case management. That's a heavy piece of it. So if someone is up all night with a youth, they can't necessarily take the day off, the next day off. So it's just complicated. And so we did have a local provider who is sort of new to the housing arena apply, went before our Youth Services Advisory Board and the resource allocation meant. And at this point, they did make the decision not to fund that application. with the understanding that other organizations that had operated had really just said it was a capacity issue. And we know these youth have high rate of traumas in different ways. And so being able to have staff who can have relationships with them over time is very important. So the resources, it's a difficult job to do, and it's a hard program to run. So that's a piece of it. But then also to understand, have a better understanding and some community-wide conversations they charge our department with. And in June, we're going to start to roll these out where we're going to bring some of these community partners to the table and start to have some conversations to better understand what the challenges are, what we're facing now. It's specifically as we come out of the COVID pandemic, or at least we hope we're coming out of the COVID pandemic, for different things. When we talk about couch surfing, right? It's youth homelessness counted differently and defined differently depending on sort of where you look for the definition from state organizations. And for now, with people not wanting kids on their couch because of COVID, they haven't been vaccinated, we know that that has changed the shape, right? And so there's a lot of different factors that the Youth Advisory Board wants us to get a better grasp on to help respond in a couple of ways. Between now and the end of the year, we have some funding that we want to make sure that we figure out how to best impact the youth, make sure that we're serving all communities. And then even for the funding within 2022, how we use that. And then we're planning on rolling out a new RFP. So these conversations will also shape the funding priorities and in the sort of the long-term range as we're able to work with our community partners and some other funders, maybe to pool some resources and see if we can't do a more holistic approach in that time range. So I just want to let you guys know that we have talked about this. We're looking at this. We know this is a need, and I don't want you to think that it's fallen off the radar. It continues to be urgent. But our board really felt that in order to be good stewards and to maximize the amount of money that we do have, we want to make sure that we know exactly where to place it. And they just didn't feel at this point that they had enough information to do that. And so we're hoping to be able to roll that out and get those answers quickly and then move on that, at least in the immediate. So that is what we're doing.
Thank you, Kate, for that update. Any questions? I see no hands. Thank you.
Sure.
And Kathy Schlatter from Human Services Coalition. Welcome, Kathy.
Hey, nice to be here. Been an interesting meeting. I don't have much to, Kit talked a lot about what we were actually doing because 211 will answer a lot of these calls around the housing. So we have been hiring people to get them in place, figuring out the differences between the ERAP money, the ESG money, the enterprise money, which is just the city, and then what the city is doing with their allocation of the ERAP money. So the one good thing, I think, Shauna, you talked about this before, is we do have someone hired who will just handle the city portion of that. So any calls that come in can go to that person, and then that person can decide whether, they'll be better for the ERAP money or the enterprise money or it would help if they didn't all start with E too, but there you go. What can you do? The other thing that we have been, all our applications for county city funding were due yesterday. So we will get our review committee together and start doing our in-depth reviews of those funding applications. We tried to make it a little less onerous on people this year, knowing that people have been through a lot. So, but asking a lot about what challenges that people see going forward. So I think that'll be some interesting information. And we also, in that same vein, just as part of our planning, did a little survey of agency heads talking about where they saw the challenges going forward in the next, we kept it small, 1 to 3 years, and what assistance they could use. And we got a really good return on that. So we'll be putting all that information together and possibly sometime be able to share with you guys where people think
that's great
their challenges will be going forward. So that's kind of what we've been up to. Oh, and I don't want to forget, and Wednesday morning, we have Shauna and Henry, I believe, and Jason and Lisa. I invited Lisa Holmes to come talk to nonprofits about this year's budget process. So that's 9 o'clock, 9 to 10 on Wednesday morning. We look forward to that.
Thank you, Kathy. Any questions for Kathy Schlatter? I see no hands. Well, thank you everyone for attending our meeting. Look at that, we have 5 minutes left. And we are going to get out a little bit early. So enjoy the sunshine, and we will see you all next month. Take care, everyone.
Thank you.